Hi, I'm Dr. Joseph Witt-Doerring, and the purpose of today's video is to talk about how to get your physician or your provider to acknowledge that the symptoms that you're experiencing may be due to protracted withdrawal. Um, so I suppose the first thing is to recognize is that although we've had people like Heather Ashton and other uh, physicians and researchers talk about benzodiazepine withdrawal, gosh, for probably nearly 40 years or so. It's only recently become more accepted by, I guess, establishment medical organizations. And that really helps when you're talking to, say, your family doctor, your PCP, or a therapist. And Probably the most useful resource I think of at this time is really that a lot of the drug labeling was updated by the FDA in 2020, and drug labels are really easy to print out. You can do it yourself online, and if you can bring them these labels that talk about the risk of protracted withdrawal, and then also describe the symptoms, that may be helpful. So um, I thought I would just actually walk you through this, as that may be helpful. So let's see, I'm going to share my screen now. Okay, so what you would do is you would go to dailymed.com, and then you could really search most benzodiazepines. You know, if you're on temazepam, you can search temazepam. Um, the one that I'll choose is let's go Xanax XR. And okay, so it will take you to the most up-to-date drug label. I always like just looking at the printer-friendly version, and where you would find the information on protracted withdrawal would be in two places. So one, it's in warnings and precautions. So you go down to section 5, and then they briefly describe it here. So they talk about, in some cases, benzodiazepine users develop protracted withdrawal, lasting weeks to more than 12 months, and then they link it to section 9. So let's go there. Before I go there, though, for something to even be in a drug label, it means it's considered to be an adverse reaction, something valid by the FDA. So it has crossed a threshold of causal relatedness for the drug regulators, that they believe it's important enough that this needs to be in the label and that the physician should know about it. So let's go have a look down here. So they have a lot of information about dependence, but this is really what we're interested in here. It's this section. Protracted withdrawal is associated, syndrome associated with benzodiazepines is characterized by anxiety, cognitive impairment, insomnia, formication. That means a feeling of like insects crawling on your skin. Motor symptoms, twitches, tremors, paresthesias, that's sensory disturbances, feeling like you have burning in your leg. Or sometimes it can be unusual feelings like there's slime running over your leg, or water. Tinnitus, it goes on to say, it persists beyond 4 to 6 weeks. Why is that important? Because usually for a normal withdrawal, most of the symptoms have resolved by then, and you're only having a few minor residual symptoms. It's been known to last longer than 12 months. And then it can be difficult differentiating withdrawal symptoms from the potential reemergence or continuation of symptoms for which the benzodiazepine was originally used. So, so the first part of helping your doctor recognize that it's real, or your healthcare provider, is to let me stop sharing now. Is to show them that this is in the drug labeling. And then the next thing that's important, because maybe you've been prescribed a benzodiazepine for insomnia, or maybe it was prescribed for anxiety. A lot of the symptoms in there can be difficult to distinguish, but then there are some symptoms in there that are really unusual, and if you have them, it would serve to emphasize them. Formication, feeling of insects crawling on your skin, that's not a symptom of generalized anxiety disorder. Tinnitus, that's not a symptom of generalized anxiety disorder or insomnia either. We've got other ones in there like muscle twitches. Maybe you're having a lot of spasms and twitches. Sure, you can have muscle tightness with anxiety, but symptoms getting to the stage where you're having visible tremors and twitches, that's a little bit unusual. So the other thing is paresthesias and neuropathy, burning sensations in your skin. So these things, they're really kind of difficult to explain away with your underlying condition. Now, sure, someone might say, they have a history of anxiety, you've got this tinnitus, you have this neuropathy, it's hard to kind of explain it. Maybe you have a conversion disorder or a functional neurological disorder. It's a way of saying that these are manifestations of your anxiety. Well, that could be the case, but when you actually have a constellation of syndromes, in a drug label that's saying, hey, we've seen a lot of patients, they've got cognitive impairment, depression, anxiety, they have tinnitus, muscle twitches. You can't really say it's due to a conversion disorder or something else because you have a recognized constellation of symptoms, which is better accounted for by protracted withdrawal. So that about sums it up. So I would say the two things are print out a drug label, perhaps your label, highlight the section on protracted withdrawal, and then you could sit down and say, sure, this may be due to my anxiety, but honestly, I've got these sensory problems, this ringing in my ears, and I've got these twitches now, and I really don't believe they can be accounted for by simply anxiety. And I think you would be in a pretty good spot if you could put that together. And once it's recognized, you can work together on treating it symptomatically, or at least, starting your journey towards finding someone that could help you with your protracted withdrawal. So I hope this video was helpful in helping you educate your providers out there and hopefully bring about better clinical care for yourself. So thanks.